afternoon, everyone. I'm Tommy. Before going into PowerPoint, I would like to ask you a question. When you have influenza, what will you get? The answer may be a fever, a sneeze, or a drug called Tamiflu. Today, I'm going to introduce my topic to you about the oseltamivir treatment on influenza A and B in Hong Kong. So let's go to see the content of my presentations. First of all, I will give you some definition of the technical words, and also then I will talk about the importance and aims of the research. Afterwards, I will show you 5 articles I have reviewed, and finally, I will conclude the shortcomings of the articles. For the definition of influenza, it is an infectious disease that transmitted through air by cough and sneeze and direct contact of bird feces and the nasal secretions. For the oseltamivir, it is an inhibitor of the influenza A and B virus to treat the disease. Why the research is so important? Because the influenza has caused serious health problems around the world. For example, every year in US there are 20,000 deaths resulted from the influenza complications. So it is very important to study the treatment of influenza, and this topic has been studied by lots of scientists. For my research, I will study the efficiency of oseltamivir treatment in Hong Kong and the age and immunity factor affecting the treatment. Also, I will study the mutation and their occurrence in the influenza B. The reasons of that will be taught in the later part of my presentation. So let's go to the article. In the first article, Kaiser study has shown that influenza will cause the LRTC. The most common complications is the acute bronchitis, and this complication occur easily in the risk populations. The study has shown that early oseltamivir treatments will reduce the occurrence of these complications effectively. The strength of this study is using the double-blind trace that prevents a bias from collecting data. However, the study lacked the standardized clinical guidelines so that the diagnosis of these complications is not specific. It leads to the unclear viral infection and bacterial superinfections resulted from antibiotics used to treat the disease. As a result, the finding of reduction of this complication is not clear. In the second article, Roberts shows that the oseltamivir treatment not only reduced the occurrence of influenza, but also prevent the transmissions in household. It controls the spread of disease in household and even in community. However, in Robert's study, they do not include the children younger than 13 years old. This kind of population is the source of introduction and spread of the disease, so it is important of the family prevention of influenza. As a result, unknown reduction of virus transmission in children reduced the value of the study. For the efficiency of oseltamivir, Kawaii study filling the gaps of knowledge. Because in the past, the oseltamivir treatment on influenza B is not clear due to not enough patients with influenza B. But Kawaii study have overcome this problem as collected fair number of patients infected with influenza B and A to be studied and find that the oseltamivir treatment is better on influenza A. However, there are 2 limitations in the study. First of all, they just concern the duration of fevers to compare the efficiency of oseltamivir treatments, but no laboratory study on the influenza B to find out the resistance mechanisms. The second limitation is that the age range in these subgroups is very large, so that the variance of the different treatment is big, leading to the unclear influences of age on the treatment. In the Sugaya study, they performed similar study, but particularly in children. They also show that the treatment is better on influenza A. Importantly, they point out that there are significant differences on 1 to 5 years old children, but similar effectiveness on 11 to 15 years old children. So it shows that the age should be a factor affecting the oseltamivir treatments. Another strength of this study is that they're using double-blind trains to prevent the bias. Again, they don't identify the resistant mechanism of influenza B. Also, antipyretics are allowed to use for safety reasons when the children's temperature are over 38.5 degrees, but how much time of fever reduced by the antipyretics is unknown, leading to the unclear results. In the Hatakeyama study, they successfully identified the resistant gene in influenza B. They find that 4 mutations in influenza B reduce the sensitivities of the oseltamivir treatment. These 3 mutations will deactivate the drugs by hydrogen bonding and soft bridge on the drugs, but they cannot find the interactions of this type of mutations. Also, in the study, the data mainly come from children, so the situation of mutations in adults is unclear. In conclusions, there are 4 shortcomings of the articles. First one is, since the comparison study are only performed in Japan, the situation in Hong Kong is unknown. And also, these 5 articles have not shown clear age and immunity factors affecting the oseltamivir treatments. And in the last article, the interactions of this mutation and the probability of 4 mutation occurrence is not shown. So it is necessary to study these gaps as my aims of my research. Finally, just some health reminder that if you have influenza, please wear your mask to prevent it, like Obama. This is the reference. Thank you for my presentation.